Food poisoning, treatment, symptoms, and causes. What is food poisoning? Food poisoning arises when you eat food contaminated with bacteria or other pathogens such as parasites and viruses. Your symptoms may range from an upset stomach to diarrhea, fever, vomiting, abdominal cramps, and dehydration. Most such infections go undiagnosed and unreported. But, the Center for Disease Control and Prevention estimates that each year about 76 million people in the United States become ill from pathogens in food, and about 5,000 of them die. Over 55% of such cases are caused by improper cooking and storage of foods, and 24% by poor hygiene, such as not washing your hands while preparing food. Only 3% of cases are from unsafe food sources. Keeping your hands clean while working with food is the single most important thing you can do to prevent food poisoning. About 20 organisms can cause food poisoning. After you eat food contaminated with bacteria, they will multiply in your stomach and bowels. Some bacteria give off a toxin when they multiply. As a result, nausea, vomiting, abdominal cramps and diarrhea occur. Vomiting and diarrhea are the body's way of eliminating the toxin, and most cases of food poisoning do not require medical attention. Not all invasive organisms cause vomiting as a symptom, but almost all of them cause diarrhea. Many types of food poisoning lead your stools to bleed, and it is regarded as one of the most serious symptoms. Symptoms of abdominal cramps are also common. Food poisoning sometimes presents itself with fever. Be sure to contact a physician if you have a symptom of a fever or bloody stools. Common sources of food poisoning. Campylobacter is the leading cause of bacterial food poisoning in the USA. It causes several million cases a year, resulting in hundreds of deaths. Eating undercooked chicken or food that has been in contact with raw chicken most commonly causes Campylobacter. The Center for Disease Control estimates that up to 70% to 90% of chickens are infected with Campylobacter. To prevent the disease, cook chicken thoroughly, with no pink spots remaining. Wash your hands frequently when you handle raw chicken. Use paper towels to dry your hands. If you are using a sponge or dishcloth to clean the counters, use a fresh one after working with raw chicken. Wash your cutting board with a diluted bleach solution before using it again. And any utensils or dishes having contact with raw chicken need to be washed and rinsed with soap and water before using it again. E. coli O157H7 infection causes an estimated 25,000 cases of food poisoning each year in the USA. Most of these result from undercooked, contaminated ground beef. The organism lives in the intestines of healthy cows. Meat can become contaminated during slaughter when intestinal fecal matters get mixed with beef that is to be ground into hamburger. Contaminated meat looks and smells normal, so it is not readily detectable. Bacteria on cow udders or milking machines can also contaminate raw milk. To prevent this form of food poisoning, cook all ground beef until no pink spots are present. Make sure all of the meat juices are clear, with no shade of pink or red, and that the inside of the meat is hot. If you are served an undercooked hamburger in a restaurant, send it back. Consume only pasteurized milk products, and drink only water treated with chlorine or other disinfectants. Botulism is caused by Clostridium botulinum, a spore-forming bacteria. This form of food poisoning is very rare but can be life-threatening. It may result from eating improperly processed, low-acid foods such as green beans, mushrooms, spinach, olives, beef, or fish. Improper home canning methods often account for botulism cases. Improperly processed commercial products can also cause this serious disorder. To avoid botulism, don't even taste canned food that is soft, deteriorating, or fermenting. It isn't worth a life-threatening illness. When in doubt, throw it out. Infant botulism is more common in spring and summer and is rare in winter. Infants younger than 1 year of age are at the highest risk. Symptoms include muscle weakness, a weak cry, difficulty in feeding, constipation, head lag, increased heart rate, and a decreased gag reflex. A baby with botulism is described as a floppy baby, as these infants have weak muscles, especially in the arms, legs, and neck. Infant botulism has been associated with eating honey. The Center for Disease Control suggests that honey should not be given to infants under 6 months old, and the Honey Industry Council extends the safety limit to 1 year. Honey is not an essential food for infants and should never be given to them. Summary of food poisoning. Most symptoms such as nausea, vomiting, abdominal cramps, and diarrhea are due to viral infections and are not true cases of food poisoning. An accurate diagnosis can be difficult because the pathogenic organisms are found in different kinds of food and have varying incubation periods. Also, eating a substance and getting sick immediately afterward is not the typical course of food poisoning. Most people are not aware that the consumption of remaining food eaten several days previously can be the cause of food poisoning. Always be sure to consult a physician when experiencing severe gastrointestinal symptoms.